Anna Robinson has our invocation this morning, and Lena Sugis is going to lead us in the pledge and four-way test. Sana, take it away.
Thank you, Keely. As I was preparing for the prayer this week, I decided to make our prayer one of the many prayers of Martin Luther King Jr. And it was really difficult to select one that I felt was appropriate for our group and for this year. But I think I found one that I believe is very appropriate. Just as I read it, even though it doesn't include a lot of the names of the people that we know that we've lost this year and some of the great members of our club and their families, please keep them in mind as I read the words of Martin Luther King Jr. Please pray with me. Oh God, we thank you for the lives of great saints and prophets in the past who have revealed to us that we can stand up amid the problems and difficulties and trials of life and not give in. We thank you for our foreparents who have given us something in the midst of the darkness and the exploitation and the oppression to just keep going. Grant that we will go on with the proper faith and the proper determination of will so that we will be able to make a creative contribution to this world. In the name of and the Spirit of Jesus Christ, we pray. Amen.
Amen. Please face the flag and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And now the four-way test of the things we think, say, or do. First,
is it the truth?
Is it the truth?
Second, is it fair to all
concerned?
Third, will it build goodwill and better friendships? And fourth,
will it be beneficial to all concerned?
All right, and now Club Secretary Jane Covington is going to introduce any visiting Rotarians or guests we may have in our Brady Bunch windows. We do have one introduction of Ted that will come a little bit later, so let's see if there's, I don't see anybody else. Jane,
well,
do you
I was
see
just
one?
going to say that we can consider Ted a guest for at least 5 or 10 more minutes, I guess. And then other than that, we have John Kreft joining us, and he's only going to be a guest for not very much longer. So that's it.
All right. Well, let's move then. Let's go to Happy Bucks and have an opportunity for folks to share what they are happy about. Who's happy? Nobody's happy.
Keely, I'll go.
Okay, go Bill.
This is Bill McCarthy. I'm happy because this past Wednesday, Kay and I celebrated our 60th anniversary, and we even went out to dinner.
Woo!
Congratulations.
Absolutely, congratulations. Who else is happy? You can't top that, but who else is happy?
I'll jump in. I'm happy we had a peaceful and celebratory transfer of power, and our nation is hopefully moving on to become a little less divisive.
Yes.
Amen.
Amen. Who else? All right. Well, those are two really good things to be happy about. So maybe we are good to stop there anyway. Patrick, are you with us today? Did you want to do an announcement on the Harpeth River? I don't actually.
I'm here. Yes. Thank you, Keely.
All right.
Yeah, just I guess one more quick plug for our Little Harpeth cleanup next Saturday, the 30th. Keely has been good to get information out through reflections. Please reach out to me with any questions via email, text, phone call. Happy to provide any information. As we've discussed, it'll be a little different this year. Everything will be outside. Always could use bodies there to help get tables set up and kind of herd the cats as folks start to come in and get registered. I've had really good response, continued really good response from our scouts. Had some emails this week from a couple of the Interact clubs, Ravenwood and Brentwood. We've got, thanks to Sherry Koss, good PR out with our social media here in the area, different homepages. So continue to talk it up, pray for good weather, and I would greatly appreciate any support you could offer, either the day of or leading a section, one of the sections of the river. So thanks to everybody.
And Patrick, just to clarify, there were two different articles that said different times for the start time. Is it starting at 8:30 or 9 this year?
Well, we try to get folks kind of out and ready to move sometime around 9 to 9:15. It just kind of depends on, where we are with getting registered and getting everybody to sign the participation agreements. I'm encouraging folks to gather between 8:15 and 8:30 so that we can hopefully get assignments, get people kind of, teamed up and assigned to the different sections so we can get moving at 9 o'clock.
Yeah, good deal. So be there as if it's starting at 8:30. All right, well, okay, Jennifer Bourne, are you here?
I'm here. I'm here twice, if you didn't notice.
Right, Jennifer Bourne, it is your turn. You get to introduce Ted as we are inducting a new member virtually today, which is always fun for everyone. All right, Jennifer, take it away.
Okay, so I get to introduce Ted Illichilian. I said that right, correct, Ted?
You are always right.
Great, I know, I'm so excited about that. Okay, so Ted moved here to Brentwood from Pennsylvania 12 years ago, and he's been living in the area since then. He's married to Anjani, is that right? And he has two beautiful daughters, Hersha and Nyla. He owns a managed IT service and cybersecurity firm, CMIT Solutions, and loves to work with small business owners. He serves on 2 nonprofit boards, and he loves to hike and travel. In fact, he is 5 states away from completing all 50 states. He just graduated in 2020 of Leadership Brentwood, so he's part of the class of Leadership Brentwood 2020. That was the introduction that is in writing. What I will say about Ted is I've known Ted for many years. I would say probably 8 or 10 years now. We've known each other quite a while. He is a super guy. He's honest. Integrity is part of who he is. And I have enjoyed working with him and also being friends with him. And he has been here to jump on the trampoline with the kids. He's just got a great spirit about him. And I'm so excited that he has decided to join our group and serve our community through Rotary. So please welcome Ted Illichilian to our group.
Hey, welcome, Ted. Ted, did you want to say a few words to the club?
Thank you so much for the kind introduction, Jennifer, and guys, appreciate the introduction and the welcome today. I'm really happy to be part of this great team. Jennifer has been telling me about this for a while, and I want to thank Alan and Charles for introducing me this group a couple of years ago. I've been visiting you guys for a while, so I hope to get to know you all personally at some point, one-to-one. But happy to be here. Thank you for having a part of this community. Appreciate that.
Welcome. And which are your 5 states that you have left?
One is Alaska, and then all the coldest states, North Dakota, Michigan, and a couple of other states. Wisconsin is one of them as well. So, yeah.
Right. I would avoid those as long as possible myself. Yeah.
But I lived in South Dakota for 3 months, and that's enough. Yeah.
Good deal. Well, welcome, Ted.
Thank you.
We are so glad to have you. All right, and now it is time to move on to our program for the day. And I believe that Ray Little is introducing today's speaker. Is that correct, Ray?
Yes. All right, and first Linus is gonna do something for us.
Well, we think Linus is going to do something for us. Let me try this again.
All right, thanks, Linus. Appreciate that. Being the fact that the COVID virus has pretty much been a war for the last 11 months, and the person who will be speaking today has been in the trenches the whole time. Somebody I greatly respect and work with, and have been blessed to be on briefings with at least once a week for the last 11 months, and that's Catherine Montgomery, Kathy Montgomery, Williamson County Health Department. If anything, the COVID virus and pandemic, I think, has shown us that we need to, even once this pandemic's over, make sure that our health departments are robust and have the resources they need to carry out their jobs and their functions. Our Williamson County Health Department has been outstanding through this whole process, and actually has led the way in many things that have even been used statewide and nationwide in how they've gone about mass testing, trying to get the vaccine out as best as possible, scheduling and all. I've been very much amazed and impressed by their work. And it's not been easy because of all the turmoil surrounding this. But just remember that many, many lives have been saved by their tireless efforts over these last 10 or 11 months. Kathy has served as the Williamson County Health Director for the past 8 years. Her career in public health spans more than 22 years, where she has worked in both state and local health departments in Florida and Tennessee. Kathy has a bachelor's and master's degree in health education from Florida State University, but her heart bleeds UT Orange in light of their turnovers, both on the field and among their coaching staff. Hopefully, she's excited about the new AD hire. She and her husband, Jim, a retired police officer and a Brentwood Police Department employee, reside in Spring Hill, and she is Gigi to 2 grandchildren, Mackenzie and Miles. It is my honor and my pleasure to welcome Kathy Montgomery. Thank you, Kathy.
Right. Thank you so much for that. You almost made me cry with the nice introduction today. So thank you so much. I know a lot of people have asked me, over the last year, what was the worst thing? Was COVID just the worst thing that happened in 2020? And admittedly, I'll have to say that no, it really wasn't, because my hairdresser moved to Texas in December and I haven't been able to find anybody to replace her. So just let me say right now, that's my, my number one priority. Okay. I'm going to try to share a little bit of I'm going to try to share my screen with you, and I'm hopeful that, hang on a second. And I might need to get Jennifer's help with this because I've not ever really done this before, Jennifer. So
we see your PowerPoint, Kathy.
You do?
Yeah, but the whole file, not the actual presentation. We see your files.
You see the PowerPoint? Okay, hang on a second. How about now? There. Okay, technology is a wonderful thing.
If you go back and unshare your screen, and then reshare just the PowerPoint presentation, it ought to work perfectly. So unshare first, and then go back and reshare.
Stop share. Jennifer, I might need some help here. I'm so sorry. How's that?
Beautiful. It looks, it is the speaker notes version of the presentation, but you should be able to make it go forward and backward, and we can follow along with you.
Okay. All right, but you can still see it?
Yep, absolutely.
Okay, perfect, perfect. So while we've been definitely involved in COVID vaccine efforts and so forth, I will say that the health department provides many, many more programs and services. We've been operating on a bit of a coup plan over the past 9 months, but I will say that we are building back up to bring our patients back in, because we do see a lot of patients that are either uninsured, underinsured, where they may have insurance, but maybe some of their medications or immunizations and things like that are not covered by insurance. So we typically serve those populations as well as patients on Medicaid. And but I will tell you that we do accept private insurance as well. And we do see a lot of patients that have Blue Cross Blue Shield and Cigna. I can't seem to get my slides to navigate. Why don't I stop sharing and I'll let Jennifer. Jennifer, can you pull up the presentation that I sent you? Is that a possibility?
I sent it over to Linus. Did you get it, Linus?
I'm looking. I'll see if I can find it. Go ahead and keep speaking. I'll keep checking my inbox, and when I find it, I'll share it.
I'll resend it here right now.
I apologize for this technical assistance issue that I have. I'm telling you, I need my 8-year-old granddaughter here to help me, obviously. I'm not sure what you can see. I can't get my slide to go down to the next slide. Let me just keep speaking until they can, until they're able to kind of get things going here for you. So we do have 2 clinics in Franklin, or we have one clinic in Franklin, and then we have our second clinic in our Fairview area as well. Just a second. I'm so sorry. Is it sharing now?
It is sharing, and it looks
There
like
you
it's
go.
advancing for you too.
Okay, perfect, perfect. There we go. Just a little bit of technology here, okay? So a couple of things I just wanted to share with you. We are a full service clinic here in our Franklin and our Fairview offices. We provide primary care services for adults as well as for children. So anything you would typically go to your general practitioner for, you could definitely come to the local health department. Physical exams, we do a lot of family planning services for women. We have a full cadre of birth control methods here at the health department. So it's not just birth control pills. I mean, our providers, we have 2 full-time physicians here in our clinic and a part-time nurse practitioner out in Fairview. But they do everything from Nexplanon to IUDs, certainly pap smears, birth control pills, and they can actually, for those who qualify, be able to refer patients for tubal ligations as well as males for vasectomies, and most of those are done free of charge. We have a full communicable disease program, so I will tell you that when COVID started, we were not new to the operations behind doing contact tracing and isolation and quarantine for people, because we already have a number of our community members that either have STDs, TB, HIV, and so forth. And we do a lot of treatment and confidential testing for those individuals. We also have a full-time dentist. Dr. Moeller is his name, no joke. Typically, we see a lot of children that don't have dental insurance. So he provides services, for example, dental cleanings, extractions, sealants and fillings and so forth. And then we do have dental emergencies available as well. And then of course, our primary care doctors do a lot of chronic disease management as well as our nurses. In our children's services, I've already covered quite a few of these. 2 I want to touch on is our Women, Infant, and Children program. So this is our nutrition WIC program that many of you might be familiar with. So we typically see a lot of patients that are either pregnant women, postpartum women, women with children 5 and under, and those who are breastfeeding. So we do have availability for a nutrition program available for them. And in the last 2 years, we've actually gone from those WIC vouchers that used to be distributed to people to an EBT debit system, so that now women can actually go to the grocery store, put all their groceries on the conveyor belt. Once they slide their EBT card, it actually takes off the items that are approved through WIC services, and then they can use their regular debit card to pay for the rest of the groceries. This is really, really critical, because I tell you, in the past, when we've had to just do the paper vouchers, you know, there's been a little social stigma to that. And we have a lot of women that typically fall off of WIC services after 1 year of being on the program, because at that time they really don't need formula, and that's why they get on the program to begin with most of the time. So this is really, really great. It's going to keep our women on the program a little bit longer. And I know you're probably like raising an eyebrow. Why is that so important? Well, what that means for the health department is that at least we're going to be able to get those children and these women into services expanded beyond just WIC here in the health department. We'll be making certain that those children are being vaccinated when they need to have their immunizations. They're going to be able to get their annual physicals, and women, we're going to get them on their family planning so that we can, you know, prevent future pregnancies if they don't want to get pregnant. The last thing I'll talk real quickly about on this slide is about our CHANT program. So we have 2 home-based care coordinators that actually assist individuals in our community with more than just, you know, special services. Really what their role is that if we have individuals that are patients of ours, and maybe it's beyond just the healthcare needs that they have, then we can assist them in identifying resources. Sometimes it's payment of an electric bill. Sometimes it's, you know, food distribution places, things like that. And it's really when families have children, certainly children under the age of 18, we're really trying to meet the needs of the entire family rather than just individuals in the family. We've helped them with beds, cribs, you name it. I mean, just a number of different resources that they're tapped into in the community to be able to engage. The other thing that these care coordinators do is we really work a lot with families with children with special needs. So if we have families that have children with special needs and they don't have insurance, or maybe their insurance doesn't cover the cost of durable medical equipment, we can actually sign them up for our program, and we can provide that financial assistance. And I say that through durable medical equipment. And we've done everything from gluten-free food for children who have celiac disease to individuals who might need a wheelchair, or, you know, hearing aids, you name it. We've done quite a bit. Then we have our environmental health program that obviously goes out and does inspections of our restaurants and swimming pools and hotels and motels and keeps us safe. I will say that as the fastest growing county in the state of Tennessee, I have to say that our environmental health program probably stays the busiest and are one of the most successful programs in the state. You know, we rarely do you ever hear about food outbreaks or anything like that, because our environmentalists are out there making sure that our restaurants and so forth are safe. And let me just say that we also have lots of events, or at least before COVID did, you know, downtown Franklin there was always a venue going on before COVID, and certainly with the fair, different things like that. They have to go out and they have to inspect those food trucks and make sure that they're sanitary, that they're clean, that the food that they're providing is safe for consumption. A lot of people don't realize that you have to come to the health department. I've been in public health 22 years, and I'm going to be real candid with you. I didn't know a lot of the services that health departments did, but we do all the vital records, all the death and birth certificates for our residents. You don't have to be a Williamson County resident to be able to get a death or a birth certificate, but certainly you can come to any local health department to get that. And we provide probably about 20,000 death certificates per year and about 10,000 birth certificates a year. So it's quite a busy program. This is just a real quick snapshot of the number of services that we provided in 2019. I'm still waiting on my 2020 data, but just in the different program areas. So our 2019 patients, while this looks like a small number, actually these patients understand come back for multiple visits. So while we may have 9,569, understand that the number of services is almost double. And for 2020, it's probably going to look a little bit lower only because we've been out doing COVID operations and been activating our continued operation plan, which is our COOP plan, and really reduce services. Overall, I'm happy to report that Williamson County is #1, has been #1 in the overall county health rankings for the state of Tennessee since 2010, and we still are today in 2020. Our rates of tobacco use, obesity, and so forth continue to be really low in comparison to the state of Tennessee. However, unfortunately, Williamson County also ranks #1 in excessive drinking, and that is for men, I believe, 3 drinks twice or 3 times a week, and for women it's 2. So we do have one of the highest rates of binge drinking in the state, and we have continued to hold that #1 spot for at least the last 5 years. And I'd like to see what it's going to be after COVID, after COVID's over. We represent a lot of partnerships and collaborations, and I'd like to just speak on 2 of these. For our Child Fatality Review Board, we sit on that committee because every quarter we meet with folks from pediatrics, from law enforcement, from our the medical inspector and so forth, and we look at cases of children who are 18 and under who have passed away in that quarter to look at whether or not we can identify trends. So for example, if we see that a number of people, a number of children maybe have passed away due to co-sleeping with parents and are SIDS deaths or have committed suicide, then we want to look at trends to see, is there something we as a local health department, as a local community can do to help facilitate some sort of community engagement or public health messaging that we can send out to individuals to try to prevent future deaths among these age groups. In our Foster Care Review Board, we also sit with a group of talented and certainly a lot of individuals from juvenile court to a lot of our court systems primarily, and our medical systems, to look at individuals who have been put in foster care. Williamson County, we're so blessed with so many resources here, and so a lot of children are placed into foster care from other counties, and so we try to assist in looking at what the health needs are for that family, for that individual, whether it's health, dental, WIC services, whatever we can do. And so we really try to work closely with these individuals to help them. And of course, we have a lot of other collaborations that we do, but I know you want me to move on because I know you really want me to talk about COVID, and I'm going to in just a minute. We do a lot of community outreach. I'll talk about only one, and that's our car seat program, because I know that, we go out into the community to do quite a bit. But just in case you didn't know that we do receive grant funding from the Tennessee Department of Health, from the Injury Prevention Program. And we actually have one of our staff members that has gone and been certified as a car seat technician. And I want to tell you, if you're a grandparent or a parent and have had to install a car seat anytime recently, it's like putting in a Rubik's Cube. There is no doubt that it is one of the most difficult things. But not only does Crystal provide installation, and she can look at any car seat that you have and be able to assist you in the installation, but we also have grant funds to purchase car seats for those individuals that meet criteria. We see a lot of our WIC moms that come in who maybe have children in car seats that are way too small. Some of them have expired, and we can go ahead and purchase these car seats for individuals and do the installation for them, really as a way to protect those children and prevent, injuries if they're in an automobile accident. My last thing I'll talk about real quickly is our built environment initiatives. I know it's already tiring to think about all the things that the health department is really involved in, but we continuously write for grant funds. And in the last 2 years, we've been able to put in soccer fields in a low-income trailer park area. We do lots of playscapes and things that promote physical activity and try to reduce obesity for our children. We've actually done a Bikes and Bowie program. So anyone who goes to the city of Fairview and goes to Bowie Park can actually check out a bicycle for free to ride on the trail if you just go during the nature center hours. So just know that that's available. We were trying to look for things in our communities that don't have as many things to do. And that was a huge initiative for us. And then the last thing we did recently in Nolansville is we expanded the sidewalk in front of Sunset Elementary and middle schools to connect with one of the main roads that they were just widening in the city of Nolansville to prevent walkability for those students who can walk and bike to school. So these are other initiatives that we do. And of course, finally, our emergency preparedness, which is always something that we exercise year after year on mass prophylaxis, which means that's just the dispensing of vaccine and medication. So I can tell you, your health department has practiced this, but nothing's as good as when it's real and it's happening to you at this time. So these are something that we do a lot. At least with practice, and this year we've gotten more than our fair share for sure. We're also working with local agencies and organizations to provide closed pod dispensing so that we don't have to, always operate a big open pod, for example, like we're doing at the Ag Center, that we can do dispensing to agencies and they can do dispensing themselves. So it kind of helps us out. And then certainly we operate with our American Red Cross, our shelters. So let me talk about the COVID testing. So since March, when the first case occurred in Williamson County, we began testing about 2 weeks after that, providing COVID testing. We always have done the PCR testing, the nasal swab that you guys are probably very familiar with. Around the middle of April, we had to expand our operations out to the Ag Center because the need and the request was much greater than what we could accommodate here at the local health department. Since that time, I can tell you that we have provided since April 1st, up until January 13th, we've provided over 55,000 tests on individuals through our Ag Center testing site. And effective about probably the first part of December, maybe towards the end of December, we started passing out self-test kits. So let me just share with you that every Monday, Wednesday, Friday, just so that we could get prepared to move into vaccinations. Every Monday, Wednesday, Friday, Anyone can come to the Ag Center, but they have to be over the age of 18 to be able to pick up a self-test kit. They can pick up a kit. They'll go out into the parking lot at the Ag Center. They will actually self-test themselves. The kit is fully contained with all the biohazard bags, the box, the shipping label, everything. So you can go ahead and self-test yourself, put it in the test tube, and put it all together in the kit, and we'll mail it or take it over to a UPS for you so that they can ship that off to the laboratory. Results come back in about a day and a half, so the results are pretty quick. Our PCR tests that we do on Tuesdays and Thursdays, 8:30 to 10:30 now, we've had to reduce those hours because of the number of COVID tests that we're doing, or COVID vaccines we're doing. Those results are going up to the state lab, and results are coming back in about 2 days. So it's still been quite a bit. I tell you, we've run this operation, and it was great practice for us as we move into vaccination. Once we get every positive test result for a Williamson County resident. So let me say this, regardless of where they got tested, if they got tested in Rutherford or Davidson, every positive test result for a Williamson County resident comes to the local health department for us to contact trace. That means contact tracing involves calling that individual and interviewing them to find out when they became symptomatic, or if they were even symptomatic, who lives in their household, who were they around, have they been at work, in the last 48 hours, and so forth. So we can quickly identify those individuals that need to be quarantined. We often will isolate the positive case for at least a minimum of 10 days. And then those who are quarantined have typically been put on a 14-day quarantine notice, except for recently when the CDC amended their guidelines to go either to 10 days or 7 days if you have a negative test result. So we've always done this, even with our STDs and others. We began vaccine distribution on December 21st. You'll see a picture there. Mr. Hardcastle not Mr. Hardcastle, I'm sorry, that's Chief Hughes. Chief Hughes was our very first person in Williamson County that got his COVID vaccination, at least through the public health department. And he was a real trooper. We've got 2 varieties of vaccine, and that's going to be changing very soon. We were offering Moderna and Pfizer. Moderna has to have a second dose at 28 days and Pfizer at 21 days. I want to say just a little bit of something about the vaccine. So moving forward, it appears that Williamson County Health Department will only be getting Pfizer. And I can tell you that I know people have been waiting a long time for that vaccine. They've been on the wait list. Believe me, we've been getting lots of calls about that, but I'm going to tell you that the floodgates are opening right now, and that we are starting to get, just this week, a lot more vaccine. It is completely complex though. I mean, we've had vaccinations that have to be frozen, but let me just say this, that with Pfizer and Moderna, or at least with Pfizer, it has to be packed in dry ice. You can only open the cooler twice a day. It's on a data logger timing system and so forth. And I tell you, it has to sit in a refrigerator for 2 hours. And then once you pull it, it has to be sit at room temperature for 30 minutes, and then you have to dilute it. So it is not an easy system, or not an easy vaccine to give, or at least to draw up, and you really have to be timely and methodical in your thought process when you're trying to schedule patients for vaccinations because of the complexity of the vaccine. We are following the state's distribution plan, and right now we're in phase 1A of 1 and 1A2, along with our 75 plus population. And individuals who wish to get a vaccination from the health department have to register on a priority list. So what they do, if you're not in one of these categories, you are not eligible to go and register on that priority list. The system will not allow you to do that yet. Okay, so once they sign up on the priority list, okay, they're placed on that list. As soon as the health department is able to open up more scheduling and more availability for patients, their names get moved from that priority list onto an invitation list, okay? And they're going to receive invitations either through emails, through text, through phone calls, so that our 75 plus residents who don't have cell phones, who don't have text messaging or email capability, they're going to receive a phone call to try to get them registered for an appointment for their COVID vaccine. Those who do get the emails and text messages are given a sign-up link, and they're given an access code. And this is really critical because we learned early on that if you didn't provide that access code to someone, they were just sharing the link with everyone, and people were registering even if they weren't in phase. And this was really keeping a lot of those individuals, the 75 plus population and others, from getting in. Once they're sent the sign-up link, they're given 48 hours to register. And if they do not register during that time frame, their name is going to be removed from that priority wait list, and they're going to have to sign up and re-register. We are opening up additional slots over the next week and the weeks forward, moving forward. Our goal for the next, at least temporarily for the next couple of weeks, is that we hope to vaccinate, and we have schedules to vaccinate 700 people on Monday, Wednesday, Friday, and vaccinate on Tuesdays and Thursdays, which are the days that we do our PCR tests, to vaccinate 400 people per day. So that's almost 3,000 people that we're going to be vaccinating per week. We currently have about 6,000 people on a wait list, but let me also share with you that wait list has a lot of duplications on it, because people, when they go in and register for the priority list, they register multiple times. A lot of people have already received their COVID vaccine through Vanderbilt or other resources that they found available. So we're hopeful that we're gonna whittle that list down really, really quick. We've got a Saturday event that'll be coming up on January 30th, where we hope to vaccinate at least 750 to 800 people, and we'll offer second doses on a Saturday in February. So that's just, I know it seemed like a lot. It's a little tidbit about our local health department and what we offer here. And I'm open to any questions, anything anyone has to ask.
Thank you so much, Kathy. We do have a few questions. Some are coming in to me private message, and some are shared with everyone. So I'll read through some of them, and we'll get through as many of them as we can in the time that we've got left. Question one is from Larry Kane. Do you interact with nonprofits in the area like Graceworks and Brightstone, et cetera?
All the time. Some of my favorite groups, we certainly do, especially our care coordinators. They'll actually, they like to reach out to Graceworks and some of the others to assist with, identifying resources for the community. So yes, we have a lot of nonprofits like that we interact with.
Awesome. Michael Kaplan asks, are vaccinations in Williamson County only for Williamson County residents, or can outside residents get them as well from the Ag Center?
That's a great question. And no, public health does not have borders. So let me just say that any of the services that you saw that I was talking about today, whether it's a COVID vaccine or a physical, you can go to any local health department to get access those services regardless of your county of residence. I will say, however, that distribution of vaccine is based on our county's population. So and our population size. So we really strongly encourage people to try to, access those services through our health department. But understood, I can tell you that Our senior residents have gotten very tech savvy at registering themselves through, local health departments around around Williamson, and been successful in getting in to other venues to get vaccinated. So.
What's your opinion on people going on their own to get COVID antibody tests? Does this really make a difference?
Let me just say that the PCR tests that are provided, whether you go to the Ag Center or whether you go to a local provider, they really are the gold standard for identifying COVID. So I'd like to just leave it at that, if that's okay.
That's fair. That's fair.
Thank you.
Are you leveraging other spaces like schools or auditoriums for vaccination operations?
Right now, we're only running our operation through the Ag Center because of the number of staffing that we have. I have to tell you that we are accessing a lot of our Medical Reserve Corps volunteers who are nurses, doctors, and so forth to assist us. Out at the Ag Center, we also have National Guard that are assisting us. There are lots of private providers who have also applied through the state to be able to access vaccine, to be able to provide it in their facility. Williamson Medical Center and Rolling Hills are two hospitals in Williamson County that have been approved as providers, and they'll be able to start giving vaccinations as well. We're utilizing, let me just say that we've also started having those conversations with the schools and with the school districts. So Franklin Special School District, for example, we are already, because they have such a low number of teachers and so forth, only about 700 staff. We've already been working with them to accommodate a Saturday event with them so that we can get them all vaccinated in one day. Williamson County Schools as well, we're working with them to identify dates and locations where we can take vaccine, or they're going to be a private provider themselves, so they'll get vaccine themselves, and we'll go out there and help their nurses and provide Medical Reserve Corps volunteers as well to get their teachers vaccinated. They've got about 7,000.
Lots of misinformation about the disease and about vaccinations and testing and all of that sort. You sort of alluded to some of that earlier. What are some of the more egregious, or one or two more egregious examples that you would really love the opportunity to set the record straight on?
Well, okay, I'll give you one. And it's probably around mask wearing, because people think that just because they wear a mask and certainly, when they're contact traced and they're still put in quarantine, but I was wearing a mask and they were wearing a mask. The masks do definitely provide a protective barrier, but they are certainly not. Most of the masks are porous, and they certainly don't provide all the protection that we need, but they certainly, prevent a lot of spread of COVID. So that would probably, if that's kind of what you're looking for, I'm not sure.
Sure.
If that's what the question was kind of alluding to.
I think the answer was entirely whatever you wanted to get. Heard the first dose of vaccine does not give as much immunity as originally thought. Is this true?
Well, it's both vaccines, both Moderna and Pfizer are both 2-dose vaccinations. Okay, so yeah, so once you've gotten your first dose, we're already scheduling individuals for their second dose to come back, and that's the one that has the little kick to it. Okay, I'm not gonna lie. I got my second dose just the other day, did not have a bad reaction to it. Several of my coworkers have. So just moving forward, and I'll say this to the group because we've also been working with law enforcement to eliminate having a whole workforce out, okay? Law enforcement and first responders actually did theirs in a phased approach so that they would, that they didn't have all their officers or all their fire department vaccinated at one time. They actually did it week by week so that when they came up for their second dose, they wouldn't have their whole workforce out, not feeling well. So, but yes, it is a 2-dose, and the second one, unfortunately, is a little kicker.
I'm gonna paraphrase and shorten the next one. We've got a new administration who has come in and set a goal for 100 million vaccines by the first 100 days. That appears to be about double or more of what's currently happening. What kinds of modifications need to be put in place in order to make that happen? Maybe what kinds of modifications that are within your control? How about that?
Okay. And that's also a tough one to answer. We have to follow the state's protocols. And so when you ask me that egregious question, okay, maybe one of those might be giving the locals a little more control than decisions made up at the top. How about that?
Man, I think you are doing a fantastic job of navigating the questions. Next one. And this one, we're looking for an exact time and date. When will it open up to 65-year-old and over? Just kidding.
Okay,
Just
so
best guess.
Okay, in the state's vaccination plan, they have indicated that it looks like around the first part of March, it's going to be 65 and older. I can tell you that, and understand too, that counties are moving at different phase levels, because there are some counties that don't have the populations, obviously, that we have. We have a huge 75 and over population here in Williamson County. So we might be at this phase for another few weeks. I can tell you that the governor is doing a press release today, and I believe it's already been done. I shouldn't probably say anything. I know that there are some counties that are probably going to open up their 70 and above. They've added a new phase in there, and I know this was not news to folks that they were going to add another phase in between 65 and 70, or between 65 and 75. So they're going to start opening that phase a little bit, and then 65 and over will probably be around the first part of March, is my best guess.
Let's see, sign-up mechanism could use some improvements. Some of the duplication may be because it appears that names that have previously signed up have dropped off and things like that. Are there efforts underway to improve the sign-up mechanism?
Well, that is something that the state is working on, and I cannot disagree with you, because when especially among our elderly population, when they're signing up, they're receiving an email notice that says you've been signed up for the priority list. Well, then no other information is provided to them for quite a while. And so those are the calls that we get. It's like, okay, where are we on the wait list? And again, it's all based on availability of vaccine and how much we're getting in, which was really, really minimal up until just this week. And also just, I ask folks all the time to please just be patient with us, because, our priority has been that once we vaccinated those first doses, our priority is always about getting that second dose in, because we're kind of on a limited time frame to be able to get them that second dose. And they'll be the priority once they get their first vaccine. But we are seeing it come in a little bit faster, and we're trying to get more appointment slots opened up so that they can make that push from that priority wait list into that invitation list to get people to go ahead and register it. And the email will say, it's your turn to get your COVID vaccine. sign up today and pick a time, pick a date that you want to come and put your information in. So, and you know, that's unfortunately, we're again at the mercy of the state, but I'm glad that they're taking on the registration process because it's still a lot for the local health departments to do. It's not a perfect system though. I can't disagree.
So we did have a follow-up on that one. So is it accurate to say that when you register, it may not necessarily show that you have registered on the site, but that registration has in fact been received? Or if it's not showing on the site, should he register again? Or maybe not sure.
Either that, or they can contact, if they want to register again, that's okay. I mean, we're having to clean, the regional health office is cleaning the list or scrubbing the list, so to speak, to look for those duplicates and remove them and go ahead and try to get people pushed over. You know, if they need to reach out to me or to our call center to look up their name to see if they're on the wait list, we're certainly happy to help with that.
Okay. A couple more that should be fairly quick, and then we're going to let you go.
That's okay.
Thank you so much. Do you have to have an appointment to get a test? And if not, what's the average wait time?
Oh, when they get an appointment or to get an appointment?
Do you need an appointment to get a test, or do you just show up?
No, you don't have to have an appointment, but understand that our testing has our number of hours is greatly reduced. However, on Tuesdays and Thursdays, when you come out to the Ag Center, I can tell you that we're probably only doing about 200 tests a day out there. And even the self-test kits, I think we passed out 65 today. I mean, it's greatly reduced. And I have to tell you some of here's another aggravation, okay? So we have repeatedly asked, you know, is that a possibility for us not to do the PCR test anymore on Tuesdays and Thursdays? And that way we could really increase the number of hours that we're vaccinating. But that has been requested and denied many times. And so we're a little frustrated here, and we know people want a vaccination. They don't care about a test anymore. You do not have to have an appointment to get a COVID test, and you could just drive out to the Ag Center, pull in.
Great. Given the details to follow to receive, store, and administer the vaccine, are you keeping up and getting it out ASAP when you get it in, or do you have to kind of sit on the supply given your available staff and operating hours?
We are getting it out as fast as we get it in. We did receive an additional quite a few doses this week, and that's the reason why we're doing a January 30th vaccination. We're going to have to schedule, because it was kind of trickling in, and then all of a sudden it was like, whoa, it came in. So that's why we scheduled a Saturday event, because we're getting it out.
Awesome. So one final follow-up on the registration mechanism. Is there a number that someone could call, or an email address that is the primary contact source for problems with registration?
Absolutely. Hang on just a minute. It was on the last slide. It was, I'm sorry, I have to look. 615-595-4880 is the number to the Williamson County Call Center. And so they can assist people if they're having difficulty registering, either on the priority list. If they get the call that they're going to be, you know, that they're next on the list to get a COVID vaccine, our call center folks can help them register if they don't know how to do that.
Okay. I've entered 615-595-4880 into the chat. So that's the number. Take a screenshot if y'all need that number. And boy, that was amazing. Thank you so much, Kathy. You ran through the gauntlet and came out on stage. That's great. Thank you so much. We appreciate it.
You're welcome. Thank you. Lots of great questions. I appreciate the opportunity.
Just a couple of announcements as we're finishing up. We missed a guest this morning. I did not see Steve when we were looking through the windows. He may have snuck in a little bit after we were looking, or I may have just skipped right over him. But Steve Huff is a guest. He is technically a visiting Rotarian and a guest this morning. I think he's gone now. He got mad at me and he left. But Steve is looking to possibly transfer his membership from the Nashville Club here. So we are glad to have had him and welcome him. Again, please remember all of our prayer concerns. We have many. We have several members who have lost loved ones recently, others who are sick or healing from procedures. So please keep Jim Ryan in your thoughts and prayers. He lost his mother last week. Jonathan Merck lost his mother-in-law last week. Again, Irene Wheelwright, Virginia Stokes, Bob Bellenfant is recovering from a foot infection and procedure. Kay McCarthy, Mary Dickerson, Robert and Dottie Fiddler. It's a long list, but they're all lovely, lovely people that we dearly care about and are going through difficult times, all of them. Also, obviously, please be in prayer and thought about our country's transition to new administration and, of course, the continuing battle with the pandemic. And on that note, I implore you all to stay safe, stay healthy, and keep serving. We are adjourned.